universities across the world. Welcome to our Ohio State University Global Analysis Summer Institute 2024. As started our courses yesterday. We will continue the course that's Health Information System Project Management. This course is aimed to a new and middle-level project manager, supports the entire project lifecycle for health information system using agile approach. So for those of you who joined today, I just want to highlight our speakers. I think we have two speakers today. One of them is Dr. Tasfahun Mellese. He's an assistant professor of health informatics at the University of Gondar, and he has a PhD and also a MPH in public health, and he has several and ample years experience in health information systems, and he has taught various health informatics courses at the University of Gondar, and he was a data manager at Davat Research Center. Thank you for accepting our requests to provide this training. Our other speakers will be Dr. Chris. I think he will join later, and I will introduce him at the middle of the session. So now I will leave the floor to Dr. Tasfu. Thank you.
Thank you so much, Samuel, for the brief introduction. Good morning, good afternoon, everyone. So welcome to the preparation stage module from the Health Information System Project Management Tool. So this is a continuous from yesterday. We have tried to touch, we have yesterday discussed about the overview of the HIS or Health Information System Project Management. So this is the continuation. So unfortunately, I will be providing this session by myself. Tomorrow, Chris and his colleagues from GMB Health System, they will be joining, and they will be discussing about HIS project management design and development. And the day after tomorrow, also they will be briefly discuss about how we can be able to implement health information system projects and how we can be able to test it. So that is the plan. I just would like to let you know this ahead of time. So thank you so much again for joining us today. I would like also to remind everyone that at the end of the course, we'll be providing a certificate. For those of you who are residing in Ethiopia, we'll be providing a CPD point certificate. So make sure you are attending more than 80% of the time, so that we can be able to provide you. So we are taking, Zoom is already taking attendance automatically. So as part of the certification requirements, so you are required to attend more than 80% of the sessions. Saying this, I will proceed with the preparation phase. So this section is part of, it is the second out of the 8 module series. And I would like to remind the participants that this training or course is for new health information system project managers and health information system teams. So the session objective is just to create an understanding on the health information system project management toolkit, focusing on the preparation templates. And then also we'll have some practical exercise on how to apply the prepared templates to your projects. So we have seen this toolkit templates. yesterday. So yesterday we had a discussion on HIS project management overview, as you can see from the screen to the left side. Today we are here. We'll be discussing about the preparation phase of the project development, or HIS Project Management Toolkit. And I'm hoping that we'll be also finalizing the project plan of the HIS Project Management Toolkit by today as well, so that colleagues from GenB could be able to proceed on the design and development part of the HIS project management by tomorrow, and the day after tomorrow they will be also proceeding on the test and implement phase of the HIS project management. So so this is the overview of the training module. So today we'll cover the first section, an overview of HIS project, the prepared versions of the HIS project management. I think before we proceed, I would like to have icebreaker exercise so that we can increase the participation. So I would like to ask the participants to change their background, which it could be funniest or the most interesting background that you like. So can you change the background of your screen, please? So for myself, let me just on my video, and then I can be able to change the background. Okay. So here I can go to the background section, and then if I'm interested in this one, then I can be able to change it, or any other image that you want, that you think it is funny, that you think it is most interesting to you. For instance, for my case, I really like most of the time the universe and the like, so I can change it to this background. Can you all do that, please?
Those of you who have done the assignments, you can say in the chat box, done. Oh, yes.
1 second, general logistics. Please don't simply leave any message on the chat box. This is on the Q&A. This is for question only, and only I encourage you just to focus on the lecture, other than asking about the certificate and other related questions. It's the certificate. It's already answered by Dr. Tasfahan. Thank you.
Yeah, I think I believe the participants are restricted not to turn off their video. So due to that, I think we cannot be able to do this exercise. So I will be proceeding to the next step. So let me turn off the video so that the internet connection will be better. So now we'll start looking at the toolkit for the prepare stage, starting from the title page. So this is the title page in the template for the preparation stage. So it is a page where you can insert the project name and also the version and the date of preparation. And also you can put the various version history down the page. Okay, version number, the author, the revision date, approved by, approved date, and whether there is changes to the version and also the reason for the change. So this is really very important to include, the title page. So the version history recognizes there should be many drafts, and table shows who approved when and major changes were occurred. So I think this is critical. So the title page is consistent across the toolkit, whether it is a preparation stage or the planning stage or design and development stage or the testing stage. So it is all similar. So just to show you what the title page looks like. So this is the template. I hope you can be able to see. So this is the template and it is version 1. You can add the project name and also the version number and the date of preparation. Okay. Please be aware that the text in the purple color shows instruction, okay, for you to make some changes. For instance, here it says, this template helps outline the high-level project scope and begin getting preliminary governance, schedule, compliance requirements outlined. It is intended to support the transition from a funded project proposal towards a project charter. So it is an instruction for you to make changes, okay? And also to give you an idea about a certain section. So it's very important to note this purple colored texts. So this is the version history in the HIS Project Management Toolkit prepare templates. So as you can see, you can add all this information. I hope it is clear for you, right? Saying this, let's go back to the slide and then see the rest of the section. So, so this is the checklist. Sorry. So this is the checklist. And in every project management template, be it preparation stage or planning stage or design and development, there is always checklist that for you to make sure all of the components of each stage are fulfilled. For instance, for the preparation stage, so there is a checklist. One is the executive summary demonstrates a clear alignment between the project and overall organization strategy. So you need to prepare executive summary for the preparation stage. And you have to also include the project scope. So it has to clearly state the reader so that the readers can easily understand what products and services or results will be delivered by the project and what high-level activities will be performed. So there are various checklist points that you need to ensure and you need to include in the project preparation template, okay? So again, to show you what the checklist looks like in the template. So as I mentioned before, remember, the purple text indicates instructions and also it can give you some idea about the templates. So here is the checklist. It's already included in the template. So you can read the pointers and make sure that all the points are included in the HIS Project Management Toolkit prepare phase. Okay. So this is the table of contents for the templates. As you can see, there is executive summary, project description, including the goals and overview, project information, and also financial consideration. And the other very important component for the preparation phase is the project organization, which includes the governance, project communication plan, preliminary acquisition plan, and preliminary project schedule and work breakdown. So these are really very critical. And the last component of the preparation phase is the compliance requirement planning. And there are also some appendixes that you need to consider in preparing the project preparation. So as I mentioned, the executive summary is an important component of this, the preparation documents, as many of your stakeholders are not going to read through the entire document. So the summary can briefly inform or provide a very good summary of the entire preparation phase. So it's very important to have executive summary, not only actually for the preparation phase, but also for the planning, for the design and development, and also for the test and implementation phase. So executive summary is really essential. I hope you understand it well. So there are some instructions for you to consider while you are preparing the executive summary. For instance, provide a synopsis of the key points of the overall project purpose and the business case. So one of the most important components of the executive summary is the purpose of the document or the project, and a business case is assist. So we have to include that so that the readers can have an idea what your project looks like. The other very important components of the preparation phase is the project description, where you can be able to include the goals and the overview of the project and basic project information, and also the financial consideration. So this is also very crucial to consider. So for instance, as a project information, you can include the project name of the investment or the project, and you can include if there is any sponsor for the project, so you can add that. And financial consideration, so there is a budget template that you can make use of it. Let me show you the template. So I'm sorry that from the place where I am presenting, there is no any electric power, so I'm just I'm using my laptop, so it has a few percentage. I hope it will not interrupt my presentation. Otherwise, I kindly request your patience for me to reconnect and then present the rest of the section. So as mentioned before, in the preparation phase, budget consideration is really important. So here is the budget consideration, and there is really very useful templates. So you can have the individual items, item number 1, item number 2, item number 3, and the like, and then you can provide description about each items and how it will be acquired, and best case estimates, most likely estimates, worst case estimates should be also included, and weighted average estimate, which is the average of this the 3 estimates. So this is really important. Okay. For instance, if you have $100 for the first item as a best case estimate, and 150 most likely estimate, and worst case estimate is 300, and considering the weighting, then you can have about 167 USD. So how it is calculated? So there are various considerations. So I will leave this for you to figure it out. Okay, so this is the budget templates. Coming back to the PowerPoint. So, so this is the project management tool pack, where you can have the budgets, template, and also other. So as I mentioned, so this is the budget. Am I disconnected? Okay. Oh, okay. The reason why is, so there is hyperlink, so I couldn't be able to get that hyperlink. So let's continue. And this is the project management case study. So if you have any experience where there is a failure for a certain health information system projects as a result of budgets, so that it would be really great to share. So the case could be like if there is any project which is failed as a result of hardware's not included in budgets, and maintenance or upgrades not included in budget, and software uses not included in the budget. So you can provide us some experience. Just to give you my own experience. So in 2021, we started the project to implement electronic medical record system in one of our hospital. So it was an ambitious plan, and we think that we can be able to implement the electronic medical record system successfully without having significant budget consideration or considering the existing resources like network, computers, and others. But later we found out that there were a lot of things that we didn't consider. So as a result, we couldn't be able to even implement that electronic medical record system in the hospital until this date. So this is, I think, a failure, a project management failure for me, because we didn't consider, important budgets considerations in our plan. So see, I hope you have similar experience. So if you have, then you can put it in the chat box so that we can learn from you as well. I think it makes a lot of sense for you to help us with access to this tool for our own use in our prospective projects. But however, is this digital system already included in the Digital Public Good Alliance registered as a digital public good? Thank you so much, Al Hassan, for your question. Definitely, we will provide this tool for you to consider for your own purpose, for your own respective projects. Definitely, we will share. And this is, I can say that it's a public good, so we can easily share it so that you can make use of the tool. Yeah. Okay. Thank you, Al-Hassan, for your question. So if you have further questions, you can always put it, yeah. So the second component of the preparation phase is the project organization. So here is a checklist of questions that can help assist you when creating a governance process for the project. And these are things to consider, the questions to reach agreement on and to document everything. Thinking about who will be responsible for signing off, who is the person ultimately who make the decisions, who will be the person who will be essential in reviewing. So all the necessary informations are need to be fulfilled. So yesterday also I tried to mention the different questions that you can raise to make sure all the governance issues are addressed in the preparation phase. Here are a couple of tools. One tool is the RASI table, which I tried to show you yesterday. So the table help you to think through stakeholders and approval process. So I think this is really very essential. For instance, for project changes that may have a budget impact. So who is the responsible person? The project manager, and accountable is the funder, and the consulted individuals or organization could be the Ministry of Health. And who should be informed? All the parties. So you can put the necessary information on the RASI table. I think this is important, and it is part of the project description. So this one is the again the governance structure, which provides the flow of information for you to think through decisions that have and do not have funding implications. So this is really important. I also mentioned this. So all these informations are included in the templates. So you can explore it later. So we'll share it with you. So unfortunately, since we don't have the time as well as the Mentimeter account, so I think we can have exercises. What health information system project governance lessons can you share with the group? What have been the sticking points for HIS projects governance? So if you have any experience, so you can raise your hand. We can give you the chance for you to reflect. So if there is any experience that you come across with any project governance or any lesson that you can share, that would be really great. You can raise your hand so that I can unmute you and you can respond there. Anyone who would like to share? Abby and Samuel, I'm sorry that I have only like 3% remaining. So I may continue for the next 4 minutes since I don't have power at this point. So we may take a break and then we'll come back.
Okay.
That's very well noted. That's very well noted.
Yeah.
Yeah. Well noted. Thank you very much. In the meantime, as a participant, you can respond for this question. Thank you. I've seen some of you are sending your response. Still, many participants want to hear from other participants, even from in the country, from Ethiopia, and also across the world. Everybody wants and have experiences. Yeah, thank you. I think Dr. Tarfo is coming. He will start soon. It's great.
I'm using a different laptop from colleagues, so yeah. Apologies for the inconvenience, everyone.
Yeah, thank you. It's understandable. Thank you for your immediate solution. Thank you very much.
So I think this is the place where we are. So if you have any project management experience about governance lesson that you know, Omar, would you like to share? So let me allow you to talk. You can unmute yourself and then you can proceed.
Okay, can you hear me, everyone?
Yeah, we can hear you very well. Go ahead, please.
Okay, thank you very much for this kinds of presentation and training. And I have a lot of experience on this area since I have been coordinating a research for the couple of 3 years. And this health informatics system have a lot of benefits that enhance efficiency, quality, and accessibility of healthcare service. For instance, in my experience, those kinds of system improve data management, since the systems allow for efficient collection, storage, retrieval, and analysis of patients' data. It was very helpful when we are collecting or managing any kinds of health-related research. And it also enhanced patient care, because with quick access to comprehensive patients' data, healthcare providers also can make more informed decisions on those kinds of tools. It can reducing the chance of medical errors, because that tools have systematically developed. In addition to this, those kinds of tools for coordinating and managing research increase efficiency, cost reduce, and it's have also different better data security, facility research and public health monitoring. Since we have different monitor for our study sites, monitors can easily and quickly can identify different public trends, public issues, and it also support evidence-based policy making. So in general, based on my experience, such kinds of instruments have a great benefit for coordinating and managing. So this is my experience. Thank you for asking, and thank you for the presentation, Doctor.
Thank you so much. Thank you so much, Umar, for your excellent description about the project governance issue or lesson that you have done it, and some of the key pointers. It's really important to note governance is really very useful, not only in project management, but also in every aspect of the health system. We need to have governance. We have to put the governance framework. We have to include the legal framework, and we have to add also governing body who will be responsible for the execution of each and every activity or project activities. So that's really very important. Saying this, I think we can pass to the next part, which is the communication plan. So this one, again, I have mentioned yesterday. So we have to have a communication plan for our projects. Okay. So the what part is what to communicate should be, included, and the purpose of the communication, and how often the communication should be made, and who is the responsible person for the communication, and how we can be able to ensure the communication is in place. So these are really very important information that we need to include in the preparation phase of a project management. So the communication plan provides you outline for a communication to support, the HIS project. So this is important. So the other one is the project schedule. So project schedule is part of the project organization, which needs to be included under the preparation plan. So here there is a description or an instruction for you to consider. Project schedule is the agreed upon set of activities or tasks or due dates used to guide and monitor the project to completion. So there are many formats and software that can support project schedules development, and basic project schedule should contain tasks, due dates, and the responsible person and the overall timeline. So you could use, for instance, Gantt chart to develop the project schedule, or there are also various software that you can consider to develop your own project schedule. So project schedule should be indicated. And for that, you need to have the preliminary project activities. Activities should be outlined. The tasks, activities are really at the top, and under each activity, you may have specific tasks. And for each specific task, you need to have due dates. and the responsible person. So this is really important. So in the template again, I'm not sure how I can be able to show you that template, but there is a Gantt chart that you may refer. So you need to be able to use that Gantt chart for your own projects. So in the project management toolpack, you can find a Gantt chart, and the Gantt chart looks like this. As you can see, there are numerous major activities as well as tasks in under each activity. So this is very important to consider, and the deliverables, the responsible person, and who should be accountable. So the RACI table, which I mentioned before, should be part of the Gantt chart, okay? RACI stands for responsible, accountable, consulted, and informed individuals. So the RACI table should be part of the Gantt charts. And you may also consider color coding for each tasks to end activities to differentiate which one is completed, which one is in progress, which one is delayed. So we need to have color coding for the Gantt charts to show the different activities and tasks and their progress. Oh, sorry. So this is an example for the Gantt charts. So as you can see, for instance, one of the major activities is identifying stakeholders. For that, different tasks are forwarded. For instance, meet with the Ministry of Health Informatics Department or with the Information and Communication Technology Department. And the next task is present at Technical Working Group. And the third task is to draft list of participants. So this way you can list out the various tasks under each major task. And then you have to have, the responsible person. So for the first task, the project management manager is the responsible person. And you have to have also the accountability or the consulted and informed individuals. As you can see here, there is a timeline. Okay, I hope you can see the cursor here. And then there are several in progress activities, and activity in January 27th is already delivered or completed or delivered deadline with a date in box. Yeah. So this is as an example where you can construct the Gantt charts. So again, case study Gantt chart gathers. So there is an example, but I think to the context of Ethiopia or my institution, I think I mentioned a problem that we faced or a challenge that we faced where we couldn't be able to meet the deadlines for our project, which is the implementation of electronic medical record system in a hospital. So that can be considered as a project management fail in relation to the planning. So the other key components of the preparation phase is compliance planning. Here we will cover this more in future sessions, but at this stage, think about what we will need to adhere to. Okay, the compliance, the laws, or the activities that we need to carry out. So health information system projects operate in complex legal and political atmosphere. So early on in the preparation phase, project managers must be savvy, uncover local laws and policies, consult international laws and standards, begin thinking about how this health information system project will adhere. So I think these are the points that you need to consider at this stage, but in the future, again, in the coming key project, HIS project management phases, we will also discuss about the compliance issue. not only at the preparation phase, but also at the planning, at the design and development. So compliance is really very important to consider. So here there is brief instruction about the compliance requirements planning. So you can focus on. And the other one is about project closing that need to be included in the preparation phase. Yeah, so remember that we are here in the preparation phase. So we need to have the closing, we have to consider the project end or the closing part. And that has to be included under the preparation phase of HIS Project Management Toolkit. Yeah. I think here we can answer this question. How do you know you are ready to move to the second project chapter template, which is the preparation phase? Now we were discussing about the preparation phase. Now we have to move to the project chapter plan. So it's important to see the transition. So there are project preparation checklists that you need to consider before you are moving from the preparation phase to the planning phase. So remember the project preparation checklist that needs to be fulfilled, okay? Which includes the executive summary, the project scope, and the preparation, the project organization, the budgeting, the schedule, and identification of the stakeholders, governance issue. So all this needs to be completed or addressed in the preparation phase before you are moving to the planning phase. So this is really important. And then once you have completed the project preparation phase, and there is an approval process for that template to be executed. So in the approval process, signature and names and the date of signature for each respective authorized personnel should be included. So this is all about the preparation phase of a certain health information system project management. So if you have any questions, you are welcome to put under the Q&A.
Yeah, thank you, Dr. Tasfan, for completing the first section on time. That's the project preparation session. Our next section will be project planning. Dr. Tasfan, as I understand, today's sessions will be covered by you.
Yeah, that's
yeah, great.
That is the plan. Yeah, tomorrow.
Yeah, great. Thank you. Yeah.
Professor Chris and his colleagues from Gen Health System will cover it.
If you have any question regarding the first session, please, even you can raise your hand, and Dr. Tasfan gives you a chance to ask a question, or you can write even in the message box. Thank you.
Angafa, I'm sorry if I mispronounce your name. So you can unmute yourself and you can ask a question. So alternatively, you can type your questions under the Q&A session part. I think administrative issue, we will be sharing. We have your contact details, that is your email. So we will share all the PowerPoint as well as the project management tool pack.
Dr. Tasfan, would you like to give them a chance to speak or to ask their question, or which one is better, to write their question on the text?
Can you hear me, Sami? Hello, can you hear me?
Sami?
Okay, thank you. I think he's arranging his
Can you hear me
No,
now?
no, Doctor
materials
was talking
for
to you, Sami.
next session. So in the meantime, let's take just a break, a simple break, like 3 to 4 minutes.
Abi, can you hear me?
Yes, definitely.
Yeah, I think it is from Samuel's side. So there are questions which are forwarded. I'm trying to respond to those questions.
Okay. Sami, can you hear? The break
Yes,
is
I
not
can.
loud. Yeah. Okay,
Yes,
the break
yes,
the
I
break
can
is not
hear you.
loud. Okay.
No, yeah, there is no
Okay.
break. Yeah, we are waiting Dr. Tesfaun till he's arranging his materials for the planning session.
Yeah,
Yeah,
Dr. Tesfaun will be responding to the questions. Okay, doctor, you may proceed, please. Sorry.
Yeah,
Please.
thank you so much. I have shared the next material, which is the project planning phase. So I will continue after I respond the question. So the first question is how we can be able to get. It is from Melissa, and he asked for the training materials. So I said we'll be sharing that training materials at the end of the training, and we have your contact detail. That is your email. So we make sure that we address or we forward the training materials, including the project management tool pack, which includes all the templates, okay, for you. But at this time, it is not organized well, so we have to make sure that we forwarded, the publicly available templates, okay? And the other question, which is forwarded from the Jenny, is why we need approval at the preparation level since we are at the starting point of the project. So I think it is a good question, Jenny. Thank you for that. We need approval. It is a document. It is, there is a template, which is about 20 pages of template that needs to be drafted for the preparation phase. So there are a number of activities that will be outlined, and under each task, you need to identify the tasks. I mean, under each activity, you need to identify the task, and you have to also set the responsible person and also the timeline and the resource which is needed. So for that, you need to get approval. So all of you remember at the beginning, I mentioned that the project preparation phase, it has its own document, and it can be changed. You can make several changes, but remember to add the version and why you make the changes. So after you made the changes, you need to get approval from the concerned individual so that those project preparation plan can be executed. And the project preparation documents are really essential for the planning phase as well. So definitely it has to be approved, okay? Thank you again for the question. From Haptawal Mulat from the University of Gondar, he asked, is this the only template we should adhere? Can we have some form of modification according to our circumstances? Definitely, you can make the modification, but after you make the modification, you have to get approval from the concerned individuals. It is a project management. We have health information system project. For instance, the one that I mentioned, electronic medical record system implementation in a certain hospital. For that, you need to have a preparation phase. And that preparation phase has to be approved by either the clinical director or the hospital administrator. And then later you can proceed to the planning phase, okay? So that is how it can go. Melissa asks a question from experience, what potential risks that could available in project preparation stage of health information system projects? Yeah, potential risks for the project. I think you can identify several risks. One is, shortage of resources, including human resource, budgets. I think there are currently in our country, even in Ethiopia, there are a number of projects which are really interrupted due to lack of projects, right? Lack of budgets or resource. So that is a risk where we couldn't be able to complete the project within time. So there are several risks, anticipated risks, natural and man-made disasters, for instance, could be considered as the potential risks. And at the end of the project, end users may not like your products, and they may have resistance to use the system. So in that case, that is a risk. But the question is how you can be able to minimize that risk. What needs to be done? Probably for the resistance, you can involve end users in each phase of health information system projects. That way, the end users will be aware on the importance of the health information system project, so that they can be part of the project and they can use the system very well at the end. Yeah, thank you. And from Brhanu, what is the driving force behind the use of health information system? We got the system for free or with a plan? I would love to hear from you, Brhanu, to explain this question further so that it can be more clear, and then I can conveniently answer. For your information, I don't have to answer the questions by myself. You guys can also respond, okay? So I will give you the chance. You can raise your hand. You can explain what I have already answered further, okay? What is the driving force behind the use of health information system? I think this is clear. Yeah, for me, the driving force behind the use of health information system is, the need to have data for decision making. Okay, we need to have data. For instance, at this time, if I want to know the number of births in the US or in one of the country in Europe, then you can easily identify, right? Because they do have vital event registration system. But in Ethiopia, if you want to know the number of births that happened yesterday, then you cannot really be able to know, because we don't have a well-established vital event registration system. So there is a need to have data for decision making. Remember that our source of data for planning, for decision makings, mostly are from census, from health and demographic surveillance sites, and from health and demographic survey, which is conducted every 5 years. Census is conducted every 10 years, right? So the data that you obtain 10 years back can help you to plan for today's or tomorrow's decision making, right? Or policy making. So, which may not be really useful because of the outdated nature of the data. So we need to have well-established health information system so that we can use it for decision making. Okay, if you have, yes, please.
Slide እየተንቀሳቀሰ አይደለም.
No, I'm not moving the slide. I'm just responding to the questions.
Oh, okay.
Yeah.
You mislead me again. Yeah, okay, thank you.
Yeah, all good. So that is, I think, the reason. I believe that major issues regarding health information system in our country are, I'm assuming in Ethiopia, because there are also participants from other countries. So in our country are sustainable and local ownership. How can we address this issue effectively? Sustainability and local ownership. So that needs to be addressed through proper health information system project management planning. Okay, project management in general. So remember the phase, the different phases of health information system project management. So to ensure sustainability, proper planning should be made. To ensure local ownership, governance should be there, right? So if we ensure each health information system project management phase are in place, then definitely we can ensure sustainability and local ownership. So that is what I am thinking. So the most important part is the planning. Once you plan it very well, then you can ensure sustainability because you can address sustainability and ownership issue in the preparation phase, in the planning phase, in the design and development, testing and implementation as well. Okay, that's why we are having this health information system project management planning. So Asaye has raised, Asaye from Jimma, I'm assuming. So you can unmute yourself and you can either ask questions or you can respond to some of the questions. Yeah. Over to you, Asaye. You can unmute yourself. Hello, Asaye.
Dr. Tasfish.
Hi, Asaye. You can. I
am Taglit.
Oh.
From Magala University.
Yeah. Hi, Taglit. Then your name says Asaye Brahanu.
Really?
Yeah, that's what it says from my side. I'm not sure.
Okay, I don't know. But yeah, I am using the link forwarded from Asaye, by the way, unfortunately.
I think that's why your name is displayed.
Sorry,
Remember,
sorry, I will try to rename it.
Yeah, remember that for your own attendance purpose, you should add your own. You should use the link which is provided for you. Okay, so that we can consider you for the CPD certificate. Proceed, please.
I am writing my name in
sorry, I just want to add on this. Even you have to register in the link, not only using. So in that way,
I have faced a problem in writing the link. There is a format, but our nation is not listed, or we cannot add our own.
You can simply say Ethiopia and other, and you can proceed. Unless otherwise, as Samuel said, use your own registration link. We cannot provide you the certificate because it will tell us another name. So I insist while we finish this today's lesson, kindly register with your own name.
Okay, I will try my best. Okay,
yeah,
thank you.
Try your best and consult Abby or me. You can consult us if there is any problem. Please continue.
I will contact you.
Okay, great.
So coming to the question, by the way, in our country, we have a massive amount of information available in the different health facilities. So to use this information, as Dr. Tasfish said, we need to have the information management system. It is difficult to use that information using the manual way of mechanism. So it is mandatory to have the health information system that uses new technologies. That is just to add and to let you know I am participating in the training.
Awesome. Thank you so much, Takle, for the supplements. Definitely, you're right. We need to have electronic or computerized health information system. Actually, when we say health information system, it can be paper-based or electronic, unless and otherwise we mention electronic health information system, okay? But these days, it's really understandable. When people say health information system, it refers to the electronic one. So we need, thank you so much. And I really appreciate your presence. Thank you for your reflection as well. So for the interest of time, I will be proceeding to the next session. We have only like 50 minutes to finish today's session. But if you have any more questions, you can add it to the Q&A, and then I will receive the report from the organizers, and then I can be able to forward reply the questions by tomorrow. Yeah. So the second phase is the plan. I just would like to say welcome to the planning phase. So we are here. We already covered the HIS project management overview, and we have also covered today the preparation phase. Now we are at the planning phase. Okay. So I just would like to remind you again, this course is for new health information system project managers and HIS teams. And the learning objective for the planning phase is to define the project planning, identify the main components of software project planning, demonstrates the health information system project management toolkit plan templates, and practice applying the HIS project management toolkit plan templates. We have icebreaker exercise. I really like having icebreaker because it makes really refresh our mind, right? So I have two questions for you. One is just to describe the state of African health information system in 3 words. Can you use the chat box to describe the state of African health information system in 3 words? So I'll give you some minutes for you to describe the state of African health information systems in 3 words, okay? It is fragmented. Yeah, let me, yeah, you said fragmented silos. If it is silos and fragmented, then the interoperability issue is there. I think you want, okay, emerging is another thing mentioned. Definitely it is emerging, poor, outdated, and overburdened, poor, uninteroperable. I got your points. Not interoperable, still needs progress. Thank you so much, Dr. Penny. It is still in progress, incomplete, inconsistent, and inaccessible. Is it, Brahanu? Can we dare to say like health information systems in Africa are incomplete, inconsistent, and inaccessible? So we need to bring data. Inadequate, not operable, isolated, disjointed, and data infrastructure issues. So Johannes, that is more than 3 words. There is duplication, lacks new technology. Thank you. Needs continuous development or improvement. Thank you, Afterworld. Failing at startup. Jibril. Thank you. Poor but improvable. That's really great to put it, put these words together. Thank you, Abdi Fatah. On the progress, yeah, it's really interesting to see your reflections. I really appreciate that. Thank you so much, everyone. I think we can go to the next question. What is your favorite food?
as energizer, you can also mention our spaghetti is coming on the top. Injera, which is a local food in Ethiopia, for those of you who are outside of Ethiopia. Porridge, which is made of, I think, rice and also some piece of meat. Malawian Thai peanut curry. Dorowat is from Ethiopia, rice and the meat. Kitfo is also a local food here in Ethiopia. A lot of things are coming. It's really interesting to see. Injera with Dorowat, which is a local food here in Ethiopia. Chicken nuts is also another one in Ethiopia. Tuhullo, what does it mean? I don't understand that. I would like to hear more from those who are outside of Ethiopia. Doro salad, Chachapsa is from local Gamfo is also here. Ahmed Najash Kakat, oh, Chachapsa, to mean Chachapsa, okay. I think it is enough for today. Thank you so much for your reflection and interaction. I'm happy that you mentioned. There are also texts in Amharic like Och or Begomen and the like. Interesting. So let's proceed to the next slide. Abby, there is long texts coming from Andrew. Thank you so much, Andrew, for your pointers. I haven't yet read it, but please take it as a note, and then we can forward it tomorrow before we start the next session. Thank you. I really appreciate your remarks, so Andrew. So moving from preparation phase to planning phase, remember the checklists that needs to be fulfilled before you move to the project charter plan. Okay, so recognize that may move between documents created in preparation stage while beginning the planning stage. So you may consider the various documents. The two stages should interrelated. Definitely the preparation and the project charter plan document should be interrelated. Remember, we have added the Gantt chart, and the Gantt chart should be detailed in the planning phase as well. So project charter and plan building of the prepare stage may require going back to in order to update the preparation document. So there could be some points that you forget in the preparation phase while you are preparing the planning document. So you may go back and make significant changes, but remember to update the version and also the approval. So yeah, so this is the toolkit that I displayed earlier. I wish I have the electric power, so that I can on my computer and share you the Excel sheet, but it is all the same. The preparation, the planning phase is almost similar to the preparation phase, but there are also detailed points included. When we start, we need to consider again, similar to the preparation phase, we have to have the project name, the version history in the title page of the project planning phase. So here is the title page of the planning phase. It's almost similar. Okay, you don't see significant difference. And here we have also a checklist. If you remember, we have we have seen the checklist for the preparation phase, where we need to make sure that there is a executive summary and project description, project organization, the Gantt charts, and everything. Similarly, we have a checklist for the planning stage. So some of the points are the project scope is clearly, we need to make sure that the project scope is clearly stated, and the project schedule is clear with deliverables. and strategic risks are identified and assessed. We have to define again a governance process for the planning. You see, remember, we have a governance issue or a governance issue that we need to address in the preparation phase. And similarly, we can have also a governance issue or process to approve. And project roles and the responsibilities, authority relationship among different team members and organizations, priority starting the design and development phase. So we need to think about also the prior pointers in relation to the design and development phase, because later we will be moving from the planning stage to the design and development phase. If major changes are made to this document, please update the version. This is what I mentioned before. Begin creating a plan for the continuous support and maintenance of the solution. So these are the checklist points that we need to consider while we are developing the HIS project management planning templates. So this is the table of content for the planning stage or phase. We have introduction included with the purpose of the project management plan, and we have also the project description included with the project, the funding source, the objectives, and the like, project requirements, project organizations, implementation planning, policy and law compliance planning, project risks issues managed. So, and also the last one is evaluation planning. So it is similar. Someone has raised his hand. Araya, would you like to? I have unmute. You can unmute yourself and then you can raise your issue. Araya is from the University of Gondar here in Ethiopia. Araya, do you have any issue that you would like to raise? Araya, I can't hear you if you are.
Hello?
Yeah, I can hear you now.
I don't have any question, Doctor. Thank you.
Okay. Thanks so much, Araya. Okay, now let's proceed to the introduction sections of the process. So here we need to have, under the introduction section, we need to have purpose of the project management plan. Okay, PMP, meaning project management plan. So we have to have the purpose. The purpose needs to be included. Okay, why do we need to have planning? Of course, it is clear. So the purpose of the project management plan is your main project management document, and this will elaborate on everything that will be considered. So the next section is the project description. If you look at the project description, you may paste from the prepared template, but you may be able to define it more in detail. So it is similar. The project description, which is outlined in the preparation phase, is similar to that of the project planning phase. So you can copy and paste the project description from the preparation phase and then paste it here, but you need to make it even more detailed, okay? So as we go along from the preparation phase to the project implementation, testing, and closing, so we need to have things more in detail, okay? Yeah. Okay. And project objective, again, the project objective are already highlighted in the preparation phase, but here you can include it more detailed, and you need to make it more specific. The project objective, which is highlighted in the preparation phase, might be generic, but here it has to be SMART. I think all of us knows about the term SMART: specific, measurable, achievable, realistic, and time-bound. So whenever we build or develop an objective in the planning phase, it has to be SMART. Okay. Specific meaning what is the defined task or objective. Measurable, what are the standards or parameters that can be counted. Achievable, is this objective feasible? Realistic, are sufficient resources available? Time-bound, meaning what are the start and the end dates. So whenever we define the objective or set the objectives, it has to be SMART, okay? So I'll give you 2 minutes for you to develop specific or SMART objectives for your own project. Can you do that? You can think of any health information system project, and then you can define the project objective, which should be SMART. So I can give you can raise your hand and then you can reflect on this. Alternatively, you can type your objectives in the chat box. Mulukan, I already said the materials will be shared, okay? Thank you for your questions. Hi, Taklit. Thank you so much for joining us today. Taklit is from Mekelle University. Anyone who would like to develop SMART objective for any health information system project? So as an example, electronic medical record system. So how can you be able to develop SMART objective for electronic medical record system design, development, and implementation? Anyone? By the end of December 2025, implement an integrated electronic health information system across 50 healthcare facilities in Oromia and Amara regions of Ethiopia, improving patient record management, data accuracy, and access to health information with at least 80% of healthcare providers trained and using the system. I really appreciate Johannes for setting this objective, but I think we can learn more on this. Can you guys pause for a moment? So Johannes highlighted several issues here. For me, yeah, it's good to bound the objective or the project by time, which is December 2025. And the objective is implement integrated electronic health information system. So you have used an action verb, which is implement, and I believe it is measurable. Okay. At the end of the day, you can ask, how can we be able to measure or know whether a project is implemented or not? So we can easily know, right? So it is measurable, I can say. But you have stated a lot of things. One is implementation. The other one is improving patient record management, which is a different objective. So when we say SMART, it has to be specific, right? So your objective is not specific because you have outlined different issues. Implementation of integrated electronic health information system is one objective. Improving patient record management is another objective. And yeah, so for me, it's good to have this example, this objective as an example. But to make it more specific, then we need to have a different objectives. But I really appreciate that you set this objective. Umar, to implement an electronic health record system in our hospital to improve patient data management and enhance healthcare delivery. So you have again stated two different objectives. One is improvement of patient data management, which is one objective. The other one is to implement an electronic health record. But can we implement electronic health record without designing and developing the system? That is one question that I would like to raise. Haptamu, thank you for the objective. Mohammed, also you have stated that to integrate human and animal surveillance data through One Health approach at the end of 2024. This is really excellent, smart objective, I can say. So here we can measure, right? The integration, we can measure it easily. So it is measurable and it is specific because it only integrates the human and animal surveillance data. So it is specific. The other one is smart, right? Achievable. Definitely it is achievable. And it is realistic. It's very possible to integrate human and animal surveillance data. And also it is time bound. So this is really a very good example, smart objective. Bethlehem also implement EMR in 12 referral hospitals within 1 year. This is also another specific smart objective. Yeah, I think there are several smart objectives outlined or listed by the participants. I really appreciate all of you for stating those objectives. Thank you so much. Now let's move to the next slide. Yeah, so this one we have already made the exercise. Remember, it has to be objective, should be smart, meaning it has to be specific. And we have to ask the question, what is the defined objective? And it should be measurable. Again, we have to ask the question, what are the standards, parameters that can be counted? And the other one is achievable, is the objective feasible? So here we raise the issue of feasibility. Realistic, are sufficient resources available? And time bound, what are the start and end dates? So this is really important. The other component of the planning phase is business requirements. So we need to have high-level business requirements. So what we mean here by business requirement is the overall requirement for this project. So we are going to get something out of the project, what is needed, why is this requirement important? So it's really easy to say what it is, but often forgotten to explain why something is needed. So high-level business requirements should be highlighted in the project planning templates. Okay, so you can see that the purple text, so which is instruction for you to guide you on how to set or define the high-level business requirements. And the other key components of the planning phase is the roles and the responsibilities on health information system projects. So once you get into the planning stage, looking at the requirements gathering process, you need to really understand how you are going to get project requirements. So this is really important. And project requirements, you know, during your undergraduate program or master's program, some of you might learn about system development process. Most of you really know this stage, and the requirement gathering is part of the system development. So, but it has to be planned, right? How you can be able to gather the requirements. Should it be through interview? Should it be through observation using observation checklist, or should we collect the requirements through focus group discussion, or should we gather the requirements by document review? So there are different ways to gather requirements for a certain project. Okay, so that part has to be included in the planning phase. And project manager is the person who is responsible to conduct the requirement gathering, but a lot of project management team members can also involve it in the requirement gathering phase. So you need to determine the stakeholders, decide how you will be approaching. I think this is very important. Okay. First, you have to determine, for instance, for electronic medical record system design and development and implementation. Who do you think is the stakeholder? Can you type it on the chat box, please? For electronic medical record system design and development and implementation, who should be the stakeholder? Thank you, Alassane, for your remark. So we make sure that we disseminate to all the audience tomorrow. The Ministry of Health, Abdel Fattah, thank you. Hospital management, City Health Bureau, patients, health professionals. This is really great. Thank you, Taklit. Mahari, private health sectors, donors, care providers. So you have forwarded several thank you, Safi, or hospital community, including the patients. Yeah, thank you so much. Yeah, you have already identified BINIA, Ministry of Health, Regional Health Bureau, Facilities, National Non-Governmental Organization, and others. Yeah, thank you, everyone. Maru, Hawi, Tamaskan, Johannes, you have also identified the various stakeholders that should be included during requirement gathering. This is very important. Remember, yesterday, one of you asked me whether we should include patients in the HIS project management process. So my answer was yes, indeed. If especially patients are part of the health information system, if we are engaging, if the patients are using the health information system, then definitely we need to include them. So once we determine the stakeholders, the next step is we have to decide how we are going to approach them. Any idea how you can approach them? What are the different ways to approach the stakeholders? Interview, thank you, Taklit. Yeah, definitely we can conduct interview workshop. Yeah, definitely we need to plan and schedule. Ashim Nafi, thank you so much. Now through conducting and reception workshop, that is really great. Stakeholders meeting, thank you. Structured questionnaire, Taklit, thank you. Mahader tells them about its importance. Workshop, letter and proposal. Yeah, we can communicate stakeholders through email. And checklists, focus group discussion, document review. Those are really the mechanisms we need to use to approach stakeholders for requirement gathering. Okay. Remember, we have to decide which one is really the best cases. Should it be interview, document review, focus group discussion? So from cost point of view, from time point of view, you can decide, okay, the various approaches. While every stakeholders may be playing a different role, project managers conducts to create a song. So this is a different scenario for requirement gathering. But we have, I think, highlighted it very well. Thank you so much for your engagement, the participants. Really appreciate it. Table here is to support you to identify stakeholders. So you can do this in iterative process to look at the type of groups, then specific people or individuals. Then you will also want to note how you will get the requirements. So this is a very important table which allows you to identify the different stakeholders and the ways that you can approach them. Okay, so this is part of the planning templates. So you can always get these templates in the planning phase. So I will share this template together with the other documents at the end of the training. Remember, the requirements gathering shouldn't be enough. It has to be validated. It has to be analyzed. Okay. For instance, if you wish to conduct a survey to gather requirements, so one individual might give you one information and another individual might give you a different information. So which information should you consider for your project requirements? So you have to analyze, you have to make analysis, and you have to take the majority, okay? And that should be the way to gather requirements. So analysis should be on board, and there has to be also validation. So you can validate the requirements that you gather either by engaging key stakeholders or experts, or you can have also the discussion with the leadership of that organization. So remember, requirement gathering shouldn't be enough. You have to also make analysis, and you have to also do validation process. For instance, recently we have developed health information exchange maturity assessment model for Africa CDC, for the Africa Union member states. So the University of Gondar has participated in this process, and we have piloted that maturity model or maturity tool in 5 African countries. But now that is not enough. That is part of the requirement analysis. But now we are planning to validate the entire health information exchange maturity model through workshop. Okay, so that means we will be inviting experts and country representatives and other individuals so that they can validate the model, whether it makes to include different components of the maturity assessment. So that is the way you can validate the requirements that you gather. So which stakeholders are not involved in this project? Why aren't they involved? You have to ask this question. Describe the process for how requirements will be analyzed and validated. I think this is what I have mentioned. The template gives sample text for how this can be done, that you may adjust as needed. So you can have the templates. We will share that template with you. And whenever you are using that template for your own project purpose, then make sure that you contextualize it to your own context, okay? Another energizer exercise, apple mango picking stretch. So I would like to ask you to stand up and pretend you are picking an apple or mango from the tallest part of the tree. Reach for that mango with your left arm, and also switch and reach for that mango with your right arm. Can you do that? You can see the picture. Can you stretch? Can you stand up and then pretend to, here I can show you the video. Oh, sorry that my video is flipped. I'm not sure why. Can I flip it? But, you know, we can stretch, okay? We can stretch, and we have to pretend that we are picking an apple or mango from the tallest tree, okay? So we can stretch, and we can switch also our other hand, okay? Yeah, I think that is enough. Thank you so much, everyone, for the exercise. I'm assuming that you did this exercise by yourself, and really appreciate it. So the other core components of the planning phase is the project organization. So under the project organizations, you need to identify the roles and the responsibilities. So again, we have a template prepared for you to figure it out, the different roles and the responsibilities. but to just give you a highlight, you can begin thinking about stakeholders. And think about direct stakeholders and indirect stakeholders. The direct stakeholders will regularly use the software or product being developed. So these are the key users or the end users, and the indirect stakeholders will be impacted by the software or product being developed or use it very rarely. So for instance, patients may be able to use the electronic medical record system during the reminder or appointment. So in that case, the indirect stakeholders could be patients, but the direct stakeholders will be the health professionals, the laboratory technicians, the professionals who are working under the medical record units for patient registration, and the physicians who are using the electronic medical record system for diagnosis, to enter the diagnostic information, as well as the treatments and the like. So you need to think about the direct stakeholders and indirect stakeholders. Once you identify the stakeholders, then you can start to write the roles and responsibilities. Again, we have the templates, which allows you to identify the various stakeholders, where you can put their names, the organizations, and the emails. And then you can have the project roles, for instance, project sponsor, which are organizations that is identifying or writing the business need, defining the projects. So example could be, so there are various examples highlighted in the templates, so you can make use of that. Okay. So the role could be the project sponsor, government monitor, project manager, technical lead, and the like. Again, remember stakeholders requirements gathering and project stakeholders project decision making. So there could be an overlap between these two terms. And remember also the client versus the user. Yesterday, I asked you to define or to differentiate the difference between clients and user. And you clearly highlighted that clients are, organizations who implements the project, whereas users are the end users of a software. So this is really very important to remember. And the other point here is the communication. Remember that we have mentioned the communication planning should be part of the preparation phase. Again, under the planning phase, communication should be included as part of the project planning phase and recognizing stakeholders. We have to outline the communications management strategy, build out a more detailed plan from the prepare stage project communication plan. So we need to capitalize what we have drafted under the project preparation phase. Okay, we have that phase and we have the communication plan. Now we need to capitalize. We need to make it in detail here. Template provides two tables here. One is required documents, for example, contracts, statement of work, external reports, internal reports, trip reports, technical working group minutes. So these are the required documents that need to be communicated across different individuals. And the other one is meeting schedule. For example, project management calls, internal project calls, internal technical team calls, external technical meetings. So we can differentiate the communication management in these two tables, the required documents as well as the meeting schedule. The other key components of the planning phase is schedule management. Okay, remember that we are still under the project organization. Okay, let me move you back to the table of contents. Okay. We have introduction, in which we highlight the purpose of the project, and the project description includes the funding source, objectives, and the like. And the project requirements, we have already identified the mechanisms to gather requirements by identifying stakeholders. And we are here, project organizations, which highlights the roles and responsibilities, the communication management, and the schedule management, okay? So we have to always remember the table of content or the contents of our templates. Begin to identify who will maintain the schedule, and likely it could be the project manager, okay? So we have to schedule the managements. You can see the templates. We need to outline the person responsible for managing the project schedule and the name of the schedule manager contact information, including email, phone, and WhatsApp or Telegram. How frequently will the schedule be revised? Who needs to be informed if the schedule changes? So all this needs to be included in the template. And the other thing that we need to address under the project organization is the change management. So we need to have the plan, and we need to specify how change requests will be started and logged and tracked. It has to be also tracked, you know. Okay. How will the change request be initiated? How will change request be logged and tracked? How will change request be assigned to personnel so that they may analyze the level of effort required and the recommendations? So these are the questions that you need to ask while thinking of the change management. The project manager is responsible for listing out the major deliverables to be completed by the end of the project. So the project management has to keep track of the project deliverables using the existing project management templates, which should be kept up to date. So an example for a deliverable for the training would be, you know, the report and the list of participants who have attended the training. Okay, so that could be considered. So the major deliverables should be highlighted under the project organization. So we have again a template for the project schedule. So remember, we have already identified or drafted the various major activities and the tasks using Gantt charts. So here we need to make it in detail. So you can use the draft from the preparation phase, okay? Again, this is how the Gantt chart, or, you know, how we can identify the different changes that can happen during the course of the project activities. So the other important thing is, you know, suggesting the risks, issues, or change logs. Okay. Yeah, so this is all about the project organization. The next step is the implementation planning, which is really very essential. Implementation planning. So in this case, we have to begin thinking about how product will be deployed and the project will be end. So this way, we can think ahead, and we can ask the question, what kind of training may be required for the end users, for the leadership, and also for different users of the project or the system. Okay. So under the implementation planning, we need to have the deployment plan. We need to have also the transition and the project closing down planning. So these are really very important key components of the implementation planning. For instance, for deployment plan, if the project involves deploying an application to health partners, and this section would discuss the approach for rolling out the application to the end users, including conducting environmental assessment, developing memorandum of understanding, and the hardware and software installation and the data conversion should be also planned very well. So these are part of the deployment plan. So the other key components of the planning phase is the policy compliance. Remember, we have also indicated the policy compliance issue under the preparation phase, but here in the planning phase, it has to be in detail, build upon plan laid out in preparation stage with suggested tables, and international standards, data privacy and security policy, if there is existing national data privacy and security policy. So we have to highlight that. IT policy of the organization. For instance, here at the University of Gondar, we have ICT policy. So we have to consider if we're supposed to develop a health information system in our hospital. So we have to consider the ICT policy. Enterprise architecture, if there is any national or institutional enterprise architecture. Digital health strategy, be it the national digital health strategy or regional digital health strategy, or institutional digital health strategy, which is cascaded from the national one. So we have to consider that. Okay. So our our project shouldn't be deviated from available international and national and institutional strategies, policies, architectures, and the like. So this is really important. So if the national strategy is different from ours, so we have to really change the gear. Instead of probably focusing on this particular project, we have to think the way to align the national digital strategy with our project. The other issue is project risk issue and the change log. So coming back to the risk planning, remember we have discussed about the risk planning in the preparation phase. Again, this is a continuous from that phase. So this is often a state that is not done particularly well in projects. So we tend to not want to consider things that will go wrong, but it's really helpful to think this through and have a formal process to think about this. So two considerations that we can consider are assumptions and constraints. So we have to consider assumptions, circumstances, or events that needs to occur for the project to be successful, but are outside the total control of the project team. For instance, conflicts might affect a certain project, right? Which is out of the control of the project. Okay, in that case, we have to consider assumptions. And the other one is constraints, anything that may restrict or limit or regulate the project. For instance, national laws, emerging national laws, new laws might affect, the project's success. So generally, constraints are outside the total control of the project team as well as the assumptions. So here again, we have the template in order to plan the risks, anticipated risks, the assumptions. Okay. Some items to consider when identifying the assumption and constraints are the schedule. Okay, schedule can be affected by the risks, right? The assumptions, and also constraints might be also affect the schedule, the budget, the resource availability, and the skill sets, the software and other technology to be used or purchased. Constraints associated with the product interface might also be affected by various risks. So these are really very important. So for each risk, you can consider also, you can classify the risks like critical, high, medium, or low risk, so that you can prepare yourself accordingly. Okay. The critical risk are high impact on the project, so it has to work with teams to eliminate the risk. So as much as possible, we should put effort in order to eliminate these critical risks, because it will significantly affect your project and it might lead you to the project failure. And the other one is the high one. You need to identify ways to reduce the probability of the risk. And the medium, consider ways to mitigate. Low, continue monitoring risks through project and scale it as needed. So these are the consideration that you need to consider in identifying the risks, the potential risks, and you have to plan yourself accordingly to mitigate the risks, okay? So these are really important. Most of the time, people ignore the risk planning. That's why most projects are failing, okay? Template tips. So I think I have mentioned the different tips that you need to consider. You can read further the purple texts, okay? Create a way to document or log or monitor risks, issues, and changes. Yeah, we need to document everything what we have, you know, the risk, the issue, or the change management, so that we can follow it accordingly. So how will risk and issue be logged and managed? Name of the person who managed the log. At which meetings will this log be reviewed? So you have to address all these things. I think if we plan really carefully, and if we identify the potential risks, and if we even categorize the risks according to like the level of risk, like critical, high, medium, and low, then we can easily prepare ourselves. So again, in the template or in the toolpack, in the project management toolpack, we have a template for you to identify the risk, issues, and change logs, and also the way to follow up this, okay? Yeah. So for the risk, initially, the team should think ahead to identify potential problems that may occur and impact the project. These risks haven't happened yet, but should be anticipated and planned for us to support, you know, the project success. So as I mentioned, an example could be, you know, conflicts which might affect a project success. The risks can be identified at any point during the project, not only at the beginning, but also it can be identified during the course of the project. So we have to act ourselves accordingly. Issues is a known problem. Remember the difference between risk and issues. Issues can be known, okay? That is occurring and requires a plan to address. These issues are gathered over time. Changes are major changes to the projects, and it has to be documented. And where else should you document? So this is a question that you need to ask. So you need to update appropriate changes, anticipated changes, issues, and risks in the projects, in the planning phase of the project template, okay? Yeah. So here are the points where we can describe the risk, the issue, or the changes, and its importance. So as you can see here, there is a description, and we have also the action plan in the template, and also a way to resolve the issues, the risks, and the changes. I hope you get the point. Can you raise your hand to tell me that you understand this, how you can be able to identify the risk, the issues, and the changes, and how you can prepare an action plan to resolve the issues, and how you can be able to resolve the issues. May I ask you to raise your hand if you understand this? Thank you so much, Yared. Thank you, Mr. Raj, Muhammad. Anyone else you understand? If you don't understand, you can let me know so that I can explain it further. Dr. Penny, thank you. Melissa, Khalid, Abaina, Simone, Masala, Naol, Mahidar, Burhan, Yared, Khalid, Alade, thank you so much. Khaireddin, Tamrat, Dejeni, thank you so much, everyone, for your reflection. You may lower your hand. You may lower your hand, please. Okay, anyone who doesn't understand or who is not really clear with the risks, the issues, and the change logs, you can raise your hand and then you can ask your question. Abra. Okay, so let me unmute you so that you can ask your question. Abra, you can unmute yourself if you have any question, and then you can ask so that I can make it even further clear. Or the attendees also can be able to reflect on this. We are almost done with today's session, guys. Sorry that we take about 10 minutes additional to finalize today's session. Okay. So if there is anything not clear, you can put it on the chat box or on the Q&A, and tomorrow I can respond for that. Okay. Risk issue and change logs again, how to use it at every meeting, or project managers can raise, the issues, the risks, and the change logs in every meeting. And you can also ensure that you capture new issues or changes that you made, or you can also review risks in every meeting. But remember that the project manager is responsible for managing this risk, issues, and change logs. Yeah. So the last key section of the planning phase is the evaluation planning. So early on in the planning process, think about what would define project success. This definition can become your evaluation criteria. I think this is really very important to consider. Utilize the major deliverables. Again, for the evaluation planning, we have a template included in the HIS Project Management Toolkit, so you can consider using that template to identify how you can be able to evaluate the planning. So here you can outline how the team would define success if those milestones or deliverables are met. For example, how does software support end users? How usable is the product? So these are some of the questions that you can ask. And the last, again, section is the closing. So for closing, for project closing, remember, when we say closing, it is for the project closing. So we have to plan for that as well. How you can be able to deliver the final product to the end users or to the clients. So here we are here, and we have to move from the project plan to the design and development. And remember the checklists that we highlighted or identified in the earlier sections of the PowerPoint. So we have to make sure that all the checklist points are addressed before we transit to the design and development phase. How do you know you are ready to move to the design and development template? Anyone who can answer this question? So now we are done with the project plan, right? So what makes us really sure that we are done with the project plan? Anyone, you can type it on the chat box. Thank you so much, Muhammad. Really appreciate it. Looking with the checklists. So it is after we see the checklist and ensure that all the checklist points are fulfilled that we can move to the design and development. Thank you, Masala, again. Thank you also, Telahon, based on evaluation. So our way to ensure that we can move to the design and development template is by taking a look at the checklist pointers. Really appreciate your involvement. Really appreciate your interaction. So thank you so much for today's session. I know that we took like 10 minutes, to run this session. So Abby and Samuel will help me in organizing the Q&A pointers, and then I can try to respond that by tomorrow. Over to you, Samuel.
Sure. Thank you, Dr. Tasfan, for your nice presentation. He was present as project preparation and project planning. It's very interesting. The project planning is a broader, which is including the whole, starting from the project preparation till the closing phases. That's very interesting. So we have to include all activities in the planning phase. That's I really like. So thank you. I really appreciate your devotion and commitment to provide this training. And also I really appreciate all participants for your active participation. So our session will end today, but tomorrow we'll continue at the same time tomorrow. So our program will be design and development session. So thank you very much. Good night. See you tomorrow.
Yeah, thank you so much, everyone. Tomorrow, Professor Chris from Genby Health and his colleague will start on the design and development phase. Yeah, have a great day. Have a great evening.
Thank you, Doctor.
Thank
you, Samuel.
Thank you, Abby.
Thank you.
Thank you. Right. And then